Most men think of masturbation as a private and harmless habit, something that stays the same from youth into later years. But after 50, your body changes in ways that make every aspect of your sexual health worth re-examining, especially when it comes to your prostate. Recent medical research has uncovered important connections between sexual activity, ejaculation frequency, and the risk of developing prostate cancer. While masturbation itself isn't harmful, the way and frequency with which it happens after midlife can have real implications for prostate health. Your prostate, a small gland just below the bladder, plays a vital role in producing seminal fluid. As men age, the prostate is more prone to inflammation, enlargement, and cellular changes that can lead to cancer. Ejaculation, whether through sex or masturbation, can help flush out old seminal fluid and potentially harmful substances from the prostate. However, certain patterns of sexual activity, combined with hormonal shifts, may also increase inflammation or stress on the gland. Urologists emphasize that understanding the balance is key. Too little ejaculation may allow toxins to build up in the prostate, while too much, especially when combined with poor lifestyle habits, may contribute to hormonal imbalances. This is why learning the science behind these effects is critical for men over 50. If you're over 50 and want to know exactly how your sexual habits may be affecting your prostate cancer risk, and the steps you can take to protect yourself, subscribe to our channel now and turn on notifications. The next chapters will walk you through what science says, what habits are safe, and what you may need to change today. The prostate is a walnut-sized gland that tends to change significantly with age. By the time a man reaches 50, the gland has often been exposed to decades of hormonal fluctuations, inflammation, and microscopic cellular wear and tear. These changes can make it more vulnerable to enlargement, a condition known as benign prostatic hyperplasia, BPH, and in some cases, abnormal cell growth that can lead to prostate cancer. One of the key factors in these changes is the balance between testosterone and dihydrotestosterone, DHT, a more potent form of the hormone. As men age, total testosterone levels drop, but the conversion to DHT can remain high, stimulating prostate cells to grow excessively. This can cause urinary symptoms such as weak stream, urgency, and frequent nighttime trips to the bathroom. Another age-related shift is in the immune response. The prostate can become more prone to chronic low-grade inflammation, a silent process that damages tissue over time and increases cancer risk. Environmental factors, diet, and even sexual habits can influence how severe this inflammation becomes. Understanding these natural changes is critical because it helps explain why lifestyle factors, including masturbation frequency, might have different effects at 25 versus 55. What was harmless in youth may require a more strategic approach later in life to protect long-term prostate health. Over the past 2 decades, several large-scale studies have investigated how ejaculation frequency might influence prostate cancer risk. One of the most cited is a Harvard University study involving over 30,000 men, which found that those who ejaculated 21 times or more per month had a lower risk of developing prostate cancer compared to men who ejaculated less often. The proposed explanation is that regular ejaculation helps flush out potentially harmful substances and inflammatory secretions from the prostate. However, researchers also note that these benefits depend heavily on overall health and lifestyle. In younger men, frequent ejaculation may be mostly beneficial, but in older men, especially those over 50, the hormonal environment and tissue health of the prostate are different. This means that the ideal frequency might not be the same for everyone and could depend on factors like inflammation levels, diet, and existing prostate conditions. There's also a distinction between healthy sexual activity and patterns that might place extra strain on the gland. Prolonged arousal without ejaculation, excessive frequency without adequate recovery, or sexual habits combined with poor hydration and nutrition can contribute to irritation and swelling of the prostate tissue. The takeaway from the science so far is not that masturbation is dangerous after 50, but that it should be considered as part of a broader approach to prostate health, one that also includes diet, exercise, medical screenings, and inflammation control. Hormones are at the center of prostate health, and their influence becomes even more significant after 50. Testosterone and its derivative, dihydrotestosterone, DHT, directly affect the growth and function of prostate cells. While testosterone naturally declines with age, DHT levels can remain elevated in some men, stimulating continuous prostate growth and potentially contributing to the development of cancerous cells. Masturbation and sexual activity temporarily alter hormone levels, including small spikes in testosterone. In younger men, these fluctuations are quickly balanced by a healthy endocrine system. But in older men, hormonal recovery can be slower, and the gland may be more sensitive to repeated stimulation without adequate rest, especially if there's already low-grade inflammation present. Another important hormone is estrogen. While often considered a female hormone, estrogen is present in men and tends to rise relative to testosterone with age. Higher estrogen levels have been linked to prostate cell proliferation and cancer risk. Lifestyle choices, including diet, body fat percentage, and alcohol intake, can influence these levels more than most men realize. This is why maintaining hormonal balance is crucial. Healthy sexual activity, whether through masturbation or partnered sex, should be combined with habits that support optimal hormone ratios, resistance training, weight management, good sleep, and nutrient-rich foods. When hormones are balanced, the prostate is less likely to undergo harmful growth changes, and the potential benefits of ejaculation are more pronounced. Chronic inflammation is one of the most overlooked factors in prostate health, and it plays a major role in how the gland responds to sexual activity, including masturbation. Inflammation can be triggered by infections, poor diet, lack of exercise, or even environmental toxins. Over time, this low-grade irritation damages the delicate cells inside the prostate, making them more susceptible to abnormal growth and cancerous changes. When the prostate is inflamed, increased sexual activity can have mixed effects. On one hand, ejaculation may help flush out inflammatory fluids. On the other, repeated stimulation without addressing the underlying inflammation can aggravate swelling and discomfort. This is why men with symptoms such as pelvic pain, urinary difficulty, or frequent urges should consult a urologist before dramatically changing their sexual habits. Inflammation also reduces the gland's resilience to hormonal fluctuations. If your prostate is already under stress from chronic irritation, the temporary hormonal shifts caused by masturbation may tip the balance toward more aggressive cell growth rather than protective effects. In this context, frequency and recovery time become even more important. The good news is that inflammation can often be reduced through targeted lifestyle changes, anti-inflammatory foods like fatty fish and leafy greens, regular exercise, adequate hydration, and minimizing processed sugars and alcohol. Addressing inflammation first ensures that any potential benefits of ejaculation are maximized while minimizing the risks to prostate health. Your prostate often sends early signals when something isn't right, but many men ignore them until the symptoms become too disruptive. Understanding these warning signs can help you adjust your sexual habits, including masturbation frequency, before more serious problems develop. One of the first indicators is urinary changes. If you notice a weaker stream, difficulty starting urination, or a feeling that your bladder isn't emptying completely, it may signal that the prostate is swollen or enlarged. Another red flag is needing to urinate more often at night, known as nocturia, which can indicate pressure on the bladder from an enlarged gland. Pelvic discomfort is another common sign. This may present as a dull ache in the lower back, groin, or even in the perineum, the area between the scrotum and anus. For some men, this discomfort is more noticeable after sexual activity, suggesting the gland may be irritated by frequent stimulation. Other symptoms to watch for include pain during ejaculation, blood in the semen, or persistent difficulty achieving or maintaining erections. While these can have multiple causes, they are signals worth discussing with the urologist. Recognizing and responding to these early signs can allow you to modify habits and take preventive measures before the situation worsens. When it comes to masturbation and prostate health after 50, there's no universal magic number that works for every man. The right frequency depends on your overall health, hormonal balance, inflammation levels, and any existing prostate conditions. What's beneficial for one man could be irritating for another. Studies suggest that moderate, regular ejaculation, around 2 to 4 times per week, may help maintain prostate health by flushing out stagnant fluids and reducing the buildup of potentially harmful substances. However, for men with an inflamed or enlarged prostate, even this amount might cause discomfort or worsen symptoms. The key is to listen to your body's feedback. If you feel pelvic pain, notice urinary changes, or experience prolonged soreness after sexual activity, it may be a sign to reduce frequency or allow more recovery days between sessions. Pairing sexual activity with lifestyle improvements, such as an anti-inflammatory diet, hydration, and exercise, can also make the prostate more resilient. Ultimately, the ideal frequency is one that supports your sexual satisfaction and overall well-being without triggering negative symptoms. Tracking how you feel after each session for a few weeks can reveal patterns that help you fine-tune your habits for optimal prostate health. Masturbation frequency is just one piece of the prostate health puzzle. To truly protect this gland after 50, it's essential to combine your sexual habits with lifestyle choices that reduce inflammation, improve circulation, and support hormonal balance. These factors work together to determine whether your prostate remains healthy or becomes vulnerable to disease. Diet is one of the most powerful tools. Foods rich in antioxidants, such as tomatoes, high in lycopene, green leafy vegetables, berries, and fatty fish like salmon, help combat oxidative stress in prostate tissue. Limiting processed foods, refined sugars, and excessive red meat can further reduce inflammation. Physical activity also plays a critical role. Regular exercise improves blood flow to the pelvic area, supports healthy hormone levels, and helps maintain a healthy weight. Important because excess body fat can increase estrogen levels, which may negatively affect the prostate. Even low-impact activities like walking, swimming, or cycling with proper seat padding to avoid pressure on the gland are beneficial. Finally, hydration and regular medical checkups are non-negotiable. Drinking enough water keeps urinary and prostate function efficient, while routine screenings, including PSA tests and digital rectal exams, allow for early detection of potential problems. When these habits are combined with a balanced approach to sexual activity, you create the best environment for long-term prostate health. When it comes to sexual health after 50, misinformation can be as dangerous as ignoring the topic altogether. One of the most common myths is that masturbation itself directly causes prostate cancer. Scientific evidence does not support this claim. In fact, some studies suggest that moderate ejaculation may help reduce risk by flushing out fluids and potential toxins from the gland. Another misconception is that more is always better. While regular ejaculation can be beneficial, excessive frequency without adequate rest may irritate the prostate, especially if there is existing inflammation or enlargement. The key is balance, not extremes. There's also the belief that abstaining completely will preserve prostate health. In reality, long periods without ejaculation may allow prostatic fluid to stagnate, potentially increasing discomfort or risk of infection. Healthy prostate function depends on periodic clearance, whether through sex or masturbation. Finally, some men think that as long as they have no symptoms, they don't need to adjust their habits or get screened. Prostate cancer can develop silently for years, so regular medical checkups are essential, regardless of sexual activity patterns. Understanding the facts and dismissing the myths empowers you to make choices that truly protect your prostate.